Thanks, Adam. Good afternoon, everyone, and welcome to today's webinar titled The Role of Family-Run Organizations Across Systems. My name is Melissa Pearson, and I am the Project Coordinator for the Family-Run Executive Director Leadership Association, or FREDLA. This webinar is being provided today as a technical assistance opportunity as a part of the TA network. The TA network is a partnership with 3 other universities and 7 organizations you see listed here. The TA network provides technical assistance to the Child, Adolescent, and Family branch of SAMHSA Center for Mental Health Services and to grantees of the Children's Mental Health Initiative across the nation to support states and communities to expand and sustain their systems of care for children, youth, young adults, and their families. The Family-Run Organization, or FREDLA, mission is to strengthen the leadership and organizational capacity of family-run organizations focused on the well-being of children and youth with mental health, emotional, or behavioral challenges and their families. FREDLA started in 2013 by 16 statewide family network directors, provides technical assistance to system of care grantees and family organizations in the form of webinars, topic-specific consultation, site visits, resource materials, leadership camps, and much more. We are excited that you have chosen to join us today to hear about the critical role family-run organizations play across the local and state child-serving systems. For over 25 years, family-run organizations have been building collaborative relationships with child-serving systems and developing networks of family members, professionals, and policymakers. Through these collaborative partnerships and networks, family-run organizations have helped empower the voice and choice of families at the child and family level, have helped develop, implement, and evaluate services at the service delivery level, and have positively impacted the policies and processes by which children, youth, and families receive support at the systemic level. As time has gone by, family-run organizations have become more sophisticated in the roles they play, thus creating the ability for them to influence change at higher levels. During today's webinar, we will discuss some of the roles family-run organizations play at the child and family level, service delivery level, and systems policy level. Let's begin our exploration at the child and family level. Many of the roles at this level focus on engagement, education, and involvement of children, youth, and families. As you can see on this slide, a lot of this work centers around recruiting and educating families and youth to become involved, connecting them with services and support, and connecting them to each other. An example of an activity at this level could be something such as a family picnic. A picnic can create a safe place for educating families about supports available and how to access them. It can orient them to the family organization and the services and supports that they provide. And it offers families and youth opportunities to develop national support networks with other families. Now, our presenters will share some examples of how their organizations have played roles at this level. We are privileged to have some very distinguished family leaders with us today. We have Gail Cormier, the Executive Director of North Carolina Families United, Sandy Bumpus, the Executive Director of the Oregon Family Support Network, and Lisa Conlon, the Executive Director of the Parent Support Network of Rhode Island. I am now going to hand it off to Sandy to share her examples.
Okay, sorry about that. So I wanted to talk about, in 2005 is when things really started to change system-wise in Oregon. And OFSN has been around since 1991, but this period of time in 2005 is a really important time in terms of really ramping up that family voice. And it started as a result of a pending lawsuit which was focused on the residential care dollars being carved out of the state budget. And so those dollars actually went back to the local and regional mental health organizations to manage. And as a part of that process, families were significantly involved. And three things happened that were really important as a part of that change. One is that as a result of that change process, all community mental health programs and mental health organizations that were providing services for kids were required to have a children's advisory committee. So including the state, local, and regional levels, all were required to have a children's system advisory committee that was made up of multiple partners around the state, including mental health. And that 51% of the membership was required to be families, youth, and other child advocates in the community. And the other thing that happened as a result of that change process was a new service delivery level at the local and regional level. And so the two services that we put into place were, number one, there were RAP-informed intensive community treatment services and high-fidelity wraparound services. Next slide. So how OFSN really supported family voice in that whole process was really more at the service level, and we were providing family navigator services right around that time, right after that Children's System Change Initiative was implemented. We began providing family navigator services. And so that was really more about helping families to access services, but also at the same time helping them to identify what their strengths were, and also to learn that they had a story in their experience. They had a story, and a lot of families that we work with in the very beginning don't even really think about that experience as being something that they can talk about in a way to be able to influence not only their own care planning, but also change in the system. And so also wraparound was provided at that point in time. So the kind of education that we provided was one-on-one with families, where we offered education classes that were really designed to bring out that family voice and to educate families about how they could use their story. And so I think what I'm going to do is stop here, because I have more to add about how that changed at the broader levels of the system. So I'm passing off to, is it Gail? Oh, to Lisa. To Lisa.
Thank you, Sandy. Just want to make sure everybody hears me okay, that I'm not cutting off.
Yep, you sound great.
Great. So in Rhode Island, Parent Support Network, we have been in existence since about 1986, 87, starting as a project out of our Mental Health Association. And so it was very early on that we started to participate and partner in the development of a statewide system of care. And of course, we went statewide right from the beginning, as in comparison to larger states working with communities, because Rhode Island is so small. So 46 miles any direction, less than an hour, and you are all over Rhode Island. So we had the opportunity to be one of the early child adolescent service system program sites when the Children's Mental Health Initiative grants came out in the early 90s. We were able to get our first statewide system of care grant that was focused on very broad-based children and youth with serious emotional disturbance. And we worked to build our collaboratives and regional infrastructure through that grant, and that was the first time that we were really starting to bring the family organization into a formal contractual role and to begin to hire family leaders in the workforce. Around 1996-97, we received our second system of care statewide grant, and that was successfully sustaining Project REACH at about $1.6 million. And with Project HOPE, we were able to focus in on really ensuring that we were reaching diverse populations, really had a plan more around looking at disproportionality, and in particular our youth who are adjudicated in our justice system, especially because we had a high level of youth of color. And we have been able to sustain that grant into our current system of care infrastructure. And then we were fortunate again to take the Positive Educational Partnership, which was real focused at an early childhood, elementary age level, and combining high fidelity wraparound with positive behavior interventions and supports, both in early childhood settings and within elementary school settings. And then finally, in fear of not creating categorical systems of care, we were able to really look at ourselves, I think for a period of a few years without looking at it from a state or federal system of care grant, and say, how do we really combine these efforts? How do we bring child welfare in? How do we get a system of care that's really set in policy and for our state beyond the support that we received through the federal grants? And we were really able to bring in our whole child welfare process, those families at risk or who were formally involved. And then through that work, we then received a system of care infrastructure grant followed by the 4-year state implementation grant. So Parent Support Network has been a partner through all of this, and we'll begin to share some of those roles. At a service, level, right where we're connecting to that family, you a lot of times will have families who haven't found the system of care yet, aren't quite sure where to get that service delivery, just looking for help and support. So we've been supported by a number of funds, both DCYF and our Department of Education, to be able to have a statewide toll-free helpline that really helps any parent in need of help and support to call into our toll-free helpline and get that support, service, navigation, and such. We have about 6 leaders who serve as peer mentors day-to-day, who are able to go to care planning meetings and other education-related meetings. We go to family court. We go to hospital discharge. This is all before being formally enrolled within a system of care or wraparound process. This is, again, helping families to find their way and supporting them at times even getting connected to more of that intensive coordination or wraparound process. In addition, we do a lot of parent education opportunities. Some of our curriculums are advocacy tips, both around navigating mental health and especially special education. We do a mental health 101, and real popular lately is social emotional learning parent workshops. And then real lot of work we do is just getting out there and doing outreach so everybody knows who we are as the Parent Support Network. So we're doing a lot of resource fairs, presentations at state agency staff, where we have been put together a nice package to not only give an overview of Parent Support Network and all our services and supports, but also being able to talk about the system of care services and supports and how to access them. We have been fortunate to be able to build a relationship with our Rhode Island Train School, Youth Corrections, and been able to connect with parents during their visiting hours with the youth. That's been a really important way that we were able to then say to the families, well, your youth could be better supported through our system of care and wraparound process, and to get involved in different activities that we're going on. We do a number of support groups for special populations, both general parenting, our youth support groups. We have Spanish-speaking support groups, and just recently, out of a very big need and also trying to change this within our system of care, are working with parents who have are in the process of termination of parental rights or who have faced that. A lot of public social events, such as organizing us as families to have fun at the zoo, go bowling, picnics, amusement parks. We find that's the best way to really get information and resources into the hands of our parents, to be able to connect with them one-on-one, and the kids have a really great time, and it draws the parents out. And of course, we use a lot of social technology through websites, Facebook, brochures, newsletters, and that. And again, I just want to emphasize as I turn it over to Gail that most of this work I'm talking about is in a broad scope with families statewide who may find their ways enrolled into the system of care and service systems, but are not always already enrolled in the formal wraparound, and we're helping them to get there.
And for North Carolina Families United, we were incorporated in 1997, and quite frankly, we do almost everything that both my colleagues Sandy and Lisa have talked about, so I don't want to really rehash that, but we do a lot of the same stuff, a lot of the social groups, the Christmas parties and all that, really at that direct service level. We do a lot of family partner direct service work, which means we do the parent support providers. North Carolina has the distinction of having the most family partners who have been nationally certified, and that's because, and I'll talk about this a little later, but at the broader level, we were able to work with the state to actually get our family partners scholarshiped in to take the certification test. So we really focus on that and make sure our family partners are highly qualified to do that peer support work. Currently, the state of North Carolina has almost 500 family partners, not all paid, but in some sort of peer support roles, whether they're volunteered or whether they are paid positions. And more every day, we get more paid positions. North Carolina Families United gives the technical assistance and the general support to anyone who identifies as a family partner, but we do hire, and we have 7 of our own employed family partners and another 5 family partner coordinators that are paid through the System of Care Expansion Grant, which I'll talk about later too. Our family partners do the navigation work with our families. We do the one-on-one work. We help them navigate the systems. We do that peer support, just being there, going with them to a meeting, sitting beside them, holding their hand sometimes when their child's in the hospital. We also happen to do the care coordination. Now that the state has done away with most care coordination in North Carolina, the family partners have become the informal care coordinators, which have given us a really good leg up on where we want to be for Medicaid billing, which, by the way, we aren't yet, but we're working on that. So we do a lot of the one-on-one peer support. We do a lot of the social groups, like Lisa said, with the parties, going for Christmas parties. That's how we get families involved, and that's also how we present our knowledge, along with newsletters to the families only. We provide Renew Youth Transition Care Coordination Services to our youth. That's a one-on-one mentoring service that we do for youth. It's paid through our block grant funds that we get from the state, and we use that money to do some one-on-one mentoring with youth, which means we use the Renew model, which I co-designed with my colleague Joanne Malloy when I worked in New Hampshire, the Renew model. From there, I took it down here because I really believe in that model, and we use Renew throughout the state of North Carolina when we work with youth one-on-one. We help them with their emotional and behavioral health care needs. And we do everything from really keeping them into schools, getting them jobs, getting them postgraduate employment, and going on to colleges and careers. We attend, if we are not working with an individual family on a full peer support model, we do some targeted interventions. For instance, some of the local agencies know that they have a family that needs 1 or 2, maybe attending a meeting or going and sitting in on care reviews. We will send a family partner out to meet the parents and just do that one meeting or that one attendance, or give them a different targeted intervention. But we do not do the full family partner navigating supports. We advocate for families and youth and children all over the state, and we also go out to all our local family organizations and our family partners that are out employed by others but need that support of a statewide family organization to help them. We do the informal supervision. We give them technical assistance and support. We field many, many parent and provider calls and questions based on the system of care values and principles. We have a hotline here that just calls in to ask parents and providers to ask us where to get different services, who do we refer out to. We oftentimes will have to send them to the community and the county that they're living in, and for them to get their system of care services. We do lots across systems, although North Carolina was very fortunate to have many, many, many system of care grants. We don't just do system of care. North Carolina Families United believes in the system of care philosophy through cross systems. So we work with the juvenile justice system, the Department of Social Services. We do family partners within the schools. We have family partners located everywhere across the state, across systems. I think next.
Thank you, Gail and Lisa and Sandy. We're now going to move to the service delivery level. At this level, family-run organization activities are frequently focused on services for the parent or caregiver and or the child-serving system. Many family-run organizations playing roles at this level offer some form of parent-to-parent support service, as many of our presenters noted in their previous examples. While this is a valuable support service, there are many other roles that family organizations can play at the service delivery level. For example, the family-run organization might provide training for child-serving professionals about how to partner effectively with parents and youth that they're working with, or how to work alongside a parent peer support provider. Several organizations have taken on evaluation roles, assessing youth and caregiver satisfaction with services or the level of family and youth involvement across child-serving systems. Now I'm going to pass it back off to Sandy to hear more about the Oregon model.
Thanks, Alyssa. So one of the things I wanted to talk about here was obviously there's some repeated information that I already gave in the first part of the presentation here. But what I really wanted to talk about is OFSN's role as a result of some of the changes that have happened over the last 10 years. And as Oregon has shifted to, having much more representation of families and youth on these policy advisory committees or quality improvement or wraparound review committees, there are a number of committees. OFSN has been more significantly involved in training and coaching families around sitting on those committees. And in every community where we're providing services, there are at least 3, sometimes more committees that folks are actually being asked to sit on. So one of the things that we do is obviously through the direct service work that we do with families through wraparound, we're continuously working with families and kind of getting a sense of how, how they are able to utilize their voice and their story as they are negotiating the wraparound process with their child and family. And there are a lot of times where families come to us and say, I really want to do something to give back. And this especially happens as they move through the transition phase of wraparound, and they're getting ready to, end those services and then manage things on their own. We also, I appreciate, Lisa, what you talked about in terms of some of the events that you have, because we also use a similar model where we bring families together for more informal kinds of activities, and we provide some of the same information to families whenever we are connecting with families. And how that training looks, there's a number of ways that we provide training. First of all, OFSN has a what we call a Peer Delivered Services Foundations training. And initially we started using that training for any parent who was interested in working with families or helping families in their community, so helping families get connected to other resources. But then as we evolved more into bringing families into the organization to actually provide those peer support services, that became a mandatory training that we offer to all families in the system who are working in that professional role, whether as a family partner or a family liaison, a family support specialist, a parent support provider. There are a number of titles out there, and so now that we're using that training to support families in their growth and learning. We also have a training that we offer families and professionals to sit on policy advisory committees together, and that is really more of an introductory training where, at least in the beginning, we didn't have families sitting on policy advisory committees, and we didn't have policy advisory committees who were used to the idea of bringing in that family voice. We developed this one-day training that would allow families and professionals to come together and learn together about how to go through that process and how to really build on the strength of the family voice, but also to build on the strength and the experience of providers in the system as well. The other thing that OFSN does at the systems level is that we actually go out and provide a lot of training and coaching. And through that process, we're working with providers at all levels. So it could be a residential provider or a community that's getting engaged with a wraparound service delivery. What we will do in that case is we'll just share some of our experience in the work that we do with families, but also in working within the wraparound system and system of care. And right now in Oregon, we have a very new wraparound expansion that is bringing on 10 new communities. Actually, some of those communities have already been providing wraparound, but they're bringing in new systems. So, for example, healthcare or juvenile justice are some of the new systems that are coming in to the wraparound service delivery. And so those systems have not had the level of experience and knowledge or work around family involvement, family-driven care, youth-guided care, and some of those concepts that we talk about a lot. So OFSN has been working also in partnership with our Youth Move statewide organization to actually build up that level of knowledge and expertise. And then we're engaging families in that process too who are at the community level where those new projects are happening. So next page. And where that leads me is that OFSN has actually been fortunate enough to receive support from our state that has really supported our training program, but in the last year really expanded its support for the training program to really build this level of work in these communities that are new. So some of the communities that we're talking about, Oregon is mostly rural. And I'll use Eastern Oregon as an example is one of the communities that we're working in. And that community is a very large region. There are 14 counties that are represented in this particular region. And we're working really more significantly right now with 4 counties who have never, but who have more limited, I would say, involvement with wraparound and system of care. And so what OFSN is doing is we're, bringing, number one, we've expanded our training program, but we're also utilizing the expertise of families who are in those communities to help inform the training process so that we're actually able to build something that's sustainable and that those families will be instrumentally involved in supporting other families in the community. Other areas of need, I think one of the things that OFSN is always doing is we're always looking at, where are we around the state in terms of developing this infrastructure of support and meaningful family involvement. So meaningful family involvement pertains to, really having families who are really well educated and knowledgeable of the committees that they're sitting on and what's happening in their community. And as most of you know, that's a big effort. And one of the things that we have found is that as we're providing direct services in the community, the ability for our staff who are working in those roles in the community have more limitations around their ability to do that. And so we're looking at ways that we can increase our infrastructure so we can continue to support that and have that that involvement of families in these new communities, especially be able to reach the level that we have in our existing communities more quickly so that they can have a greater impact. And then the other thing that OFSN does is we have a statewide family leaders group that meets on a quarterly basis. And what that group does is that they come together and meet and really inform not only themselves but the state around topics or system changes that are really important to them. And some of the examples that I want to talk about are the healthcare transformation obviously was a really big process that we were involved with. And then this whole notion of non-traditional workers, which I've heard other folks around the country talk about. In the state of Oregon, there was a process where a group came together, several groups of non-traditional healthcare roles came together to talk about the fact that we need to organize and develop some kind of definition about what these roles are and how they're going to interact in this new healthcare system. And so OFSN was pretty instrumentally involved in that because peer support initially was not part of the conversation in those meetings when they first started, but then they did become involved in talking about peer support and what that means, both on the child and family as well as the adult systems level, and across mental health and addictions. And so those were very important places for us to be thinking about and advocating, and so we used the statewide leadership group to facilitate some of our own learning, but also to make recommendations to that particular work group, the non-traditional healthcare work group. And then the other thing I wanted to say is that obviously through the wraparound expansion, I talked about the fact that some of these new projects are bringing in new systems that haven't been involved, so juvenile justice, the healthcare system, in some cases developmental disabilities. And one of the things we're also seeing is that in some of the rural communities, the whole community is actually coming together. And so that we're starting to see the discussions about families change in those communities. And we're coming in and talking about family involvement, family engagement, and really how to create a system of care that really models the system values and principles. The only other thing that I'm going to add is that one of the things that we're really starting to experience now, too, is that we are starting to become more involved in work groups that are either collaborations of joint systems. So, for example, a recent statewide group that has come together is a joint mental health and juvenile justice task force that is coming together to really address some of the issues and challenges around kids who are in the juvenile justice system who have mental health needs. So I think I'm going to stop there and pass this off again to Lisa.
Thank you, Sandy. So as we talk at this level of looking at our partnership within Parent Support Network and the system of care, we have been able to work intensively with the state out of our Child Welfare Institute at Rhode Island College to help develop an advanced family support partner training and certification that goes along with our whole RAP certification. Right now we have over 28 family support partner positions in place who are working on RAP teams with coordinators that are serving either families at risk of becoming formally involved and who have mental health challenges with their children, or those families who are formally involved in child welfare, which in Rhode Island could include voluntaries for high-end children's behavioral health needs, to involvement with probation, to families who have been formally charged with abuse and neglect, and we're working with them towards reunification and support as youth who may be in congregate care are coming back into their homes. So of these 28 family support partners, in addition to Parent Support Network leading a lot of the training and certification, we are employers of 6 family support partners who are working with families who are in the formal level of involvement with DCYF or child welfare. And so in that position, we are doing a lot, which I would say is very intensive work, and we're doing that in partnership with our networks of care within Rhode Island. We have are there right from initial contact, helping to meet immediate emergent needs, beginning to build that engagement. We do a protective capacity checklist. We do the family empowerment scale. We're trying to engage and really work with the families wherever they are and building that support and reunification planning that they need as those decisions get back made in a court process, which the wraparound plan is actually presented in the court process. Parent Support Network, we've also been part of a state team, which is an interagency state-based team that has been looking at our definition of peer support service delivery in an effort to ensure that we're on the right track towards Medicaid reimbursement, and then also what our state certification guidelines and curriculum look like that to match. So our work that we've been doing for family support partners with the Child Welfare Institute has definitely combined with that. We're also strong partners in the recovery movement, working with the peer support there. We've just reached now where we're part of recovery coach training. All our staff are being trained as recovery coaches, and we also now have in our state a peer support specialist certification that Medicaid is starting to acknowledge. So we're on our way, that we're doing the feasibility and the work that's going to help us become directly Medicaid reimbursed, but at this time our networks are Medicaid reimbursement and we're part of their bundle, so we subcontract more directly with them. We deliver both individual and group Parenting Wisely curriculum where we are reimbursed for those services directly from the service delivery care networks, and or we get direct calls right from the DCYF social workers who are assigned in addition to the RAP process coordinators and such. So we are also in the process of bringing on strengthening multi-ethnic families, and we'll be rolling that out in April, and that's also more evidence group based. And we're looking to that curriculum that really helps more, where I'd say Parenting Wisely has been effective in helping parents to get stronger around their parenting skills, understand the behaviors of their children, and also help to decrease the delinquency or at-risk behavior, where strengthening multi-ethnic families is really going to get into protective capacity building, supporting families to find their natural resources and connections networks. We have a family evaluator on staff, and we're starting to also discuss building a team of additional family evaluator consultants who are leading the our wraparound fidelity easy index and track outcomes, because we're a state implementation grant under SAMHSA. So we do lead those evaluation efforts and then partner back with our system of care to really look at how we can combine those findings, which they take their lead evaluators along with our year partners to do all the analyzing of our data, which is nice because what we're finding is our organization's starting to have more doors opening for us, and universities and partners such as Brown and Yale wanting to help us look at how we can do more measurement internally around our practices. In addition, we have both a statewide, full-time statewide family leadership coordinator and a statewide youth leadership coordinator who their role is predominantly, I think as Sandy and Gail have both talked to really well, they focus on recruiting, training, and coaching parents and youth to really participate in our statewide system of care infrastructure, which would be either our State Family Community Advisory Board or what we call our local FCABs, which we have 4 regionals. And these boards are all, really their primary responsibility is to really give a lot of advisory and look at quality assurance of the delivery of the network. So we've had to, especially the work of Cherie and Allison, who are our leadership coordinators, even helping to orient and support the families and youth to really understand data, evaluation processes, being able to ask really good questions, knowledge of the system of care. So they take a lot of the leadership to bring that to each region, to meet one-on-one and coach these parents and youth. The youth have been working on an overall statewide strategic plan and how they're going to organize youth involvement and leadership to the next level, which has been really nice because they did a formal needs assessment and is partnering with Yale on how to bring that to the next step. So I'm going to stop there and turn it back to Gail.
Oh, thank you, Lisa. What North Carolina Families United does in this middle level, where it's the beginning of the macro level, this is where some real work and some real family voice gets involved. As I had said earlier, we do informal care coordination for both families and transition-aged youth. We attend the care reviews as part of the RAP team. And the care reviews here in North Carolina come out of the mental health organizations, the MCOs, and that is where they have care reviews for families and children who are going to, they're in crisis situations where they may end up in residential treatment facilities. Psychiatric residential treatment facilities, or PRTFs, we are the advocate members. We usually serve as the family voice to get the young people back into their homes or into their communities and not be put outside of the state even. We have family members from North Carolina Families United, and we have many of our family partners and family members sit on the state collaborative. We have a pretty large North Carolina state collaborative that was developed first under our first system of care grant here in the state, but has just turned into a state collaborative of cross systems. So we sit at a state meeting twice a month where we have a chair, 2 chairs, an agency chair and a family chair. The family member does not have to be a member of North Carolina Families United, nor does it have to be a family partner. And a family partner in this term is the people who do that one-on-one peer support. It's a family member, and that's defined as a person who has been the primary caretaker of a child who has received multiple services. So we support and train the co-chairs. In everything in the state of North Carolina Families United was able to advocate that on all policy committees, we would always have 2 chairs, an agency chair and a family chair, so we could represent the voice of both, because we do believe that both voices are very important. We are members, and we also chair, or co-chair I should say, the Mental Health Planning Council, which oversees the mental health block planning funds. We do receive money from those block grants, but I can talk about that later. We're a member of the State Transition Collaborative. North Carolina Families United has a large youth division. Not only do we do the Renew model with the one-on-one support, but we also have youth leadership, where we do a 7-part series that trains young people to be advocates and to express their youth voice in a positive manner. Once those youth members go through youth leadership, they then can choose to become part of our Youth Move North Carolina. Youth Move North Carolina is our Youth Move group, and it's statewide. We also have local chapters such as Youth Move Surrey, Youth Move Greensboro. But everybody who is in the local Youth Move chapters are part of the Youth Move North Carolina state chapter. That's with North Carolina Families United. There we have a lot of youth voice going on. We have youth that have not only testified at the state level at the legislature, but also at the national level. And we have a lot of youth who participate in telling their stories during Children's Mental Health Month. We have a lot of people in Washington. In fact, one of our Youth Move leaders is now the chair of Youth Move National, Brittany Holt. We have quite a few of our youth have moved on to become national leaders in the youth movement and state leaders. We are members of the State Training Collaborative, which is very, very important. We were able to, as part of the Training Collaborative, family and agency, we put forth service definitions that really looked at family-driven wraparound services. And we were able to write into service definitions that they would get a certain different child and family team training. So basically the wraparound meeting trainings and how many hours you would have to take. That training was developed by that training collaborative, of which families all had an equal share with agency people in developing the training. And that's the training any provider of mental health services in the state of North Carolina must use if they want to bill Medicaid. We are also really working hard with the state Medicaid office to make family partner work Medicaid billable. Something that Sandy mentioned, and it has been, if I can give you any key hint on how to grow the family movement, it would be the quarterly family meetings. We started, when I came to the state in 2006, I started using the mental health block grant dollars to host a quarterly meeting of anyone who identified as a family member, family leader, family partner, to come, and we could, begin the process of workforce development and sharing of ideas and talking about policy in a very broad sense. The first meeting, there were 6 of us. The second meeting on the quarterly meetings, there were 8 of us. But during those times, we came up with the statewide definition of what we thought a family partner was. We came up with the name family partner. At first, we decided would it be family advocate, family provider. The consensus was family partner, so that was our nationally adopted name. We then came up with a definition of what a family partner is. And we're very, very happy that we also worked with the National Federation of Families after we came up with those both, the definition and the name, to actually help them or work with them and be able to provide them our information. So when they did start the parent certification process and that test, they took ideas from our definition. So that was very nice. We also, so the quarterly, then when we got the definition and we got the name, we brought it to the state collaborative so we could have it recognized at the state level that yes, everybody would recognize that the name, family partner, and the definition that went with it, a primary caretaker of a child within services, any services, and that has been endorsed. We moved up to developing, that quarterly meeting went from 6 to 8 to 20. Our list grew. So as I had mentioned earlier, we have a list of 500 people that are eligible to go to the quarterly meetings. We usually have 50 to 80, depending on where in the region of the state we host them. But it's a real workforce development meeting. At those meetings, we talk about how to expand the workforce, how to get more people certified as a parent support provider. How, what are the real problem-solving issues that we have to get in, to talk about in our own area. And we also bring in a policy person and have them talk about the upcoming policies just to educate us. We absolutely and positively never lobby. We just like to educate everybody broadly and hopefully objectively on the policies that are coming up both locally, state, and nationally. So anyways, we go on with that. And that's that team building area. And that is really, those quarterly meetings, that education, that development of the workforce is what really brought the state from having 8 to 10, maybe 12 family partners in the entire state to that list that I have that is 500. And that's not even as comprehensive as it could be because, we've missed people. But our state has recognized now the value of family voice, of family-driven care, and of the family partner peer support navigators. So that piece there in those quarterly meetings grew that and has engaged every agency to want to be a part of this growing movement, which has been really excellent. And I'll say next.
Thanks, Gail and Lisa and Sandy. You guys have offered some wonderful examples for folks. So now we're going to move to the systems policy level. And this level can sometimes be a bit more difficult to establish roles. However, when family organizations are able to develop roles at this level, it really creates an opportunity for some large-scale change to occur. So there are a lot of different ways that family-run organizations can get involved at the systems and policy level. For example, a family organization might be contracted by their state mental health department to recruit, train, and support family members to serve on state-level decision-making bodies. Some of these examples from our presenters were given about how they play a role in supporting and mentoring and developing those family members for those types of opportunities. Or a family organization might partner with an agency to develop more family and youth-focused policies and procedures that govern their organization. So at this level, we're really moving up, as Gail mentioned earlier, to a macro level and really taking a look at the governance of systems, developing policies that are aligned with the ability to support family and youth leadership and involvement and the roles of family-run organizations. We're moving to a level of really the organization supporting big picture advocacy, as Gail mentioned, sometimes supporting families and youth to share their stories at that level, and then moving family-run organizations into roles that they can be involved in decision-making bodies at a level where big picture decisions are made, potentially funding decisions or policy decisions. So I'm going to pass it back off to Sandy to finish her examples at this level, and then we will wrap up.
Okay, thank you. So in terms of governance, there are a number of committees that OFSN participates in at the state level that provide that governance function. And one is the State Children's System Advisory Committee. And that committee has been in place for about 10 years now and is made up of a pretty wide representation of systems level providers with 51% representation of families, youth, and advocates. And so one of the things that early on that happened with that committee is that there was an intentional design of that committee that at least one of the co-chairs of the committee would be a family member or a youth. Right now we have a youth Youth Move Oregon individual who is co-chair of that committee. And I just give an example of that group is actually working on a number of systems initiatives, and how they provide that governance function. They actually are advisory to the Oregon Health Authority which is the department that the Addictions and Mental Health Division is in. And there are a number of things that they do to provide addictions and mental health with policy direction. And that is, every year they go through a process where they actually have a prioritization, a discussion like, oh, what are the things we're going to focus on, for this year? And they'll go through that process, and then we'll choose 3 to 4 different areas. Usually it's 3 areas because they're really pretty big areas. An example for this year that the group is working on is early childhood, early intervention. That's one area that was designated as being really important because Oregon is also redesigning its early childhood system at the same time that they're rolling out the healthcare transformation. And then another area that is a focus for this year is suicide prevention and outreach activities that connect with that. OFSN and Youth Move have been pretty instrumental in terms of training families who sit on that committee to really push through a policy agenda. An example of that is when this committee first formed, it was right around the same time that the Federation of Families came out with their definition on family-driven care. And so at that time, as that was happening at the Federation, there were families and youth actually coming to this committee and saying, we need a policy around family-driven care for the state. The Federation has come out with this wonderful document about what family-driven care is. We need to take a look at that, and we want our system to reflect those values and principles. And so that was one of the things that that families and youth did to facilitate that discussion. It resulted in a policy on meaningful family involvement. That policy has been revised at least once. And now in Oregon, our Youth Move organization has actually spun off of out from underneath OFSN's umbrella and is now their own entity. So now there's also effort happening in that work group to develop a policy on young adult, how am I saying it? Meaningful involvement for young adults as well. The other thing that I wanted to share with folks about this governance level is that when the healthcare transformation took place in Oregon, it was actually a little bit ahead of the national rollout of the ACA. And so our mental health organizations went away, and we actually now have what we're called these coordinated care organizations. And the coordinated care organizations, there are 16 of them around the state, and each one is required to have a community advisory council with 51% consumer representation. And their definition of consumer representation is, anyone who's receiving services in the system. So that would include adults and families who are receiving, and even youth who are receiving a wide variety of services around healthcare, including physical health, mental health, and behavioral health, other behavioral health services. And we have some representation on those councils, on those community advisory councils. But also, as a result of that change, there are these executive-level councils in some of the communities, and OFSN sits on those committees as well. Those committees are actually decision-making bodies for those local regions. And so some of the things that they're making decisions are on are very high level, and they're just getting started, so I don't have a lot of specifics to bring in terms of examples right now, but that's a new place where we're becoming involved. In terms of policy development, again, I just want to kind of tag on what Gail was saying about the family leaders group that she has. We're doing some of the similar work here with our family leaders group. And one of the things that's happened over the years in this family leaders group is they're not just our OFSN staff or families, they're also families who are working in other provider organizations or in other systems who are able to participate. So we could have as many as 15 to 25 people attending one of these meetings. And in the past, this group has been, it's been a place where they receive a lot of information, as I mentioned earlier, about changes at the systems level. And one of the things that they are working on recently is really looking at their relationship to some of these governing bodies. For example, the Children's System Advisory Committee is one place that they are really wanting to develop a relationship with that work group, so that any of the recommendations or things that they would like to see have some policy work done on it, that would feed into the Children's System Advisory Committee. So they're actually in the process right now of redefining who they are and how they want to function. And some of the other work that happens with that group is we do have the addictions and mental health policy person come quarterly, especially when the legislative session is on. And that person will share with the group what's happening at the legislative level related to children's mental health or other types of legislative activities that might be important or interesting to us as it relates to families and children. Decision-making bodies, I just, with the new wraparound expansion, there are new decision-making bodies that are also coming into play. And one of the things that we're doing in that whole process is that we're really looking at informing communities who are involved in the new wraparound expansion to help them understand that they need to have, and we're encouraging them to have family involvement, family voice at every level. So it would be the service level, the program level, and the governing level as well. And so, and that work is just getting underway right now too. So there's a lot of things happening with that. I think we've been kind of evolving this work at this level for a number of years, and I feel like we're starting to see some real sophistication in terms of the things that families are doing. As an example, it's not uncommon that you would see one of these work groups that OFSN or families are involved in to present some kind of issue brief around a particular issue or topic that they want to float by the committee and have moved into some kind of policy. And that's a very high level of involvement, I think, that the families have. There are also executive committees that are part of some of these larger committees that I'm talking about, and so we actually have families who are engaged at that level as well. So I feel like this is an area that we're continuing to evolve in, but those are just a few examples of what we're doing here in Oregon. So I'm going to go ahead and pass this off again to Lisa.
Thank you, Sandy. So as we've been thinking about the work at a system policy level, both within our partnership with the system of care, we're doing some work, but also just to try to influence and impact mental health in general, and other service systems such as special education and such. We're always trying to not only assign our staff, but recruit additional family and youth on state policy boards. Right now, I would do our governor's appointed council on behavioral health. We probably have been able to help place right now 4 to 5 family leaders are on that council, along with 1 young adult. This is really important because, as most people know, there's a lot of adult focus at a governor's council at times, so we're always trying to work really hard to bring the children's agenda to that body. We also sit on the state Medicaid task force, as most states have been going through Medicaid redesign, especially with the Affordable Care Act. We are participating on that task force, and not only as it results to the Medicaid changes, we sit on what's called the Rhode Island Health Coverage Leadership Team, which really was a partnership between our Economic Institute for Poverty and our Rhode Island Kids Count to really bring us together and look at how these impact and changes on the Affordable Care Act. And of course, our attendance there and the family leadership that we're bringing to that meeting is the focus of our population. So one of the things we were instrumental in was like a fact sheet for our youth through age 26 who were involved in child welfare on making and ensuring they were going to get the medical coverage that they needed. So, those are a few examples of our state policy boards. I probably could go over a list of 15 or so, and we're always working on generating those partnerships there. We have been very much participants in our state system of care standards, which are actually endorsed and put through a state process where they have to have public hearings. So we have been part of all that standard development and actually helped to hold focus groups with families and youth so that they could bring that engaged involvement into bringing their voice into the process beyond our organization of staff. In addition, we participate both in federal and state review processes, whether that's for the child welfare standards, whether it's when the, SAMHSA has come in to even look at our state plan in relationship to behavioral health, being able to go on site visits as we've gotten our own local community networks of care up and going. We're always trying to make sure we have a family and youth voice being part of those site visits and how they're taking place. I'm really excited to say that Sheree and Allison, who serve as our Family and Youth Leadership Coordinators, they are now located at our Department of Children, Youth, and Families, which is really nice. They're there with our project director, working together hand in hand with the executive leadership team that is positioned at the Department of Children, Youth, and Families so that they can be much more involved in those executive level policy discussions. It makes a huge difference having them there and then being able to say, I can jump in on that meeting, I can provide input, I can go back and get the voice of families and youth. This has even helped with our young adults, Allison, growing up as a youth in care and also having a LGBTQ background. She has gotten and been part of a whole policy looking at the whole delivery and needs and rights of our LGBTQ youth who are in the service system, and actually has brought a lot of great training into the state through our Youth Pride and partners to really look at our transgender youth who are also high numbers of in care. So this work has helped us, excuse me, in relationship, we're always providing ongoing policy and legislative training opportunities with our parents and youth. We do have a formal Agents of Transformation training, which is about a 16-hour curriculum, and we have done that statewide in Rhode Island. It's also been replicated both in Connecticut and Allegheny County with Pittsburgh folks. I think what's really important is right around that January time where we're going into a budget process, and the legislative session is where we do a booster shot to really organize and make sure we're looking at what our agenda is and providing some policy and legislative involvement 101 with our families and youth. We do a lot of public awareness events and advocacy demonstrations at the State House. So we'll, again, being a small state, I think that's where we've been effective in being able to say, hey, everybody get to the State House and participate in that demonstration. So we've held rallies. Just recently, in Rhode Island, we have probably the highest counts in the nation of opiate overdose, so we've started to really partner and to the point my staff have been trained on how to deliver the naloxone so that we can help bring people back to life who are overdosing. And we did a demonstration in partnership with our recovery partners in raising awareness on the same day that our new governor went into office. Again, we're just doing ongoing participation as much as we can with policymakers at legislative hearings and commissions to really organize our families to be able to go in and help educate and share with their legislators and provide testimony. I think this has been a huge piece for us in helping to build our budget and sustain our system of care in Rhode Island. And as we've received many of those federal grants I talked about in those prior years, it has really helped to share what we learned and could demonstrate through those grants that have added dollars to our state budget. Harder now in the climate we are in, and I think a lot of our policy work now is how we integrate with the public health agenda and really helping people to understand behavioral health as part of chronic health conditions, but even more important, get to those social, emotional determinants that really do have an impact on helping our families to be really healthy and well. Turn it back to you, Gail.
I think this high macro level is where the sustainability of family voice really is embedded throughout the state. And it's also the sustainability of your own organization, too, because at this level, we're talking about what the money, and the money makes the policy sometimes, and the policies will help. We set policy-making committees for the PRTF, which is the Psychiatric Residential Treatment Facilities. One of the things that we do quite a bit is we are very, very, very proud of being the statewide family network for North Carolina, and we take that title very, very seriously. So we are forever giving technical assistance to our local family organizations and to our local family members throughout the state who need some TA. The other piece of that is we are now doing a lot of integrated healthcare informational sessions, and we do a lot of the Affordable Care Act. We have done quite a bit of, in fact, we got a letter from President Obama himself, sort of, thanking us for helping educate and register many, many families in our state for health care and educating other families on the new policies, and we do a lot of that work. We also sit at we initiate or recommend grant-funded initiatives for family, youth, and children. What I mean is several years ago, we had tried for the System of Care Expansion Planning Grant, and we did not get it. Well, the folks at the state level 2 years ago were sort of burnt out on that and really didn't feel like they could go after it again. It was North Carolina Families United that helped get that off the ground and initiated, and we brought it back up to the state and we said, we'll do some of the work. And offering to do that work accomplishes a couple of things. A, we're actually getting some burden off of our state partners' shoulders by doing the work, and B, we're able to actually craft the ideas that we know are important to sustain and expand system of care for families. So to do the work, and it is a lot of work, we get what we need out there, and we're very fortunate to have a state DHHS that is really open to working equally in obtaining and working with development and the implementation of different grants. Long story short, we got the System of Care Expansion Planning Grant, and we were just awarded the System of Care Implementation Grant. For both those grants, North Carolina Families United is a lead partner in it. We share the directorship, the program directorship with the state people. Myself and Walt Kaysen at the state level are the project directors, and under us, North Carolina Families United staff member Philip Stonecipher does exactly what Lisa said. He is embedded at the state level at DHHS, but he is paid for by me through that grant, and he is the project coordinator for the System of Care Expansion and Implementation Grant. That way, he is right there. He has the ear of the state, and he has the ear of the families, and if they need meetings, they will, if they're hosting a meeting for policy for families and youth, Philip is always there. We oversee the state online training for System of Care. I had mentioned that the State Training Collaborative develops the child and family team trainings, and we're pretty much, North Carolina Families United is the keeper of the information. So those who have trained, we get those names, both family members, and we get agency people who are co-trainers who have been qualified to be co-trainers to do the child and family team training. We are the keeper of the list. We also, out at the collaborative level, we as a collaborative team, state team, developed an online training. And that online training has been under the state collaborative oversees it, but the state collaborative had enough energy and trust in North Carolina Families United that we're the fiscal agent for the online training. The online training trains folks, not in person, but how to do child and family team in different system of care and cultural trainings that are in a line with system of care. We charge $45. The state collaborative charges $45 a training, and some of it, that money goes into a separate state collaborative account, which North Carolina Families United acts as the fiscal agent, which is a great sign of state trust, and that is because as a family organization, we have to go above and beyond and really, if we commit to something, we have to make sure we do a really darn good job. I'm hoping that that's why we do it, and that's why we have gained that kind of trust to sit at that executive level so high. We act as the state partner for Family Voice. Anything that has Family Voice, the state is forever calling North Carolina Families United, and if I cannot do it, my youth director or my family support director will go up to the state and sit and talk, and I am very grateful that everybody listens. We host many, many family and youth voice forums throughout the state, and we facilitate, again, the State Family Partner Quarterly meetings, the certification processes, and the training. What I didn't mention prior to this was during the quarterly meetings, we've also came up with the list of competencies of what it takes to be a good family partner, and eventually we developed the family partner training that the state uses right now. So, and we came up with the list of the 5 courses a family partner needs to take in addition to the Family Partner 101. And we came up with the electives that family partners need, and the idea that after you take the 5 courses and the 2 electives, you need to work a year in the field before you can even take the certification test at the national level. So I think what I see is just really, really follow through and realizing that we have a lot of good work here. Really quickly, Youth Move North Carolina, our youth sit at all the same level meetings that our family people sit at. So we have a lot of voice up there, and I'm very fortunate that North Carolina sees us as partners. Thank you.
Thank you, Gail. As you can see, there's an endless array of opportunities for family organizations to play roles across systems, as was so wonderfully demonstrated by Gail and Lisa and Sandy. So we want to leave you with just a few final thoughts. And the first is that we would really encourage you, as our presenters talked about, to be creative. Family-run organizations can be service providers, educators, evaluators, advocates, and policymakers. There really is no limit to what family-run organizations can do. The second concept is to model the way. And when systems engage family organizations across a variety of levels and in diverse roles, it creates opportunities for a new way of doing business. It creates a new standard of excellence that involves engaging youth, families, and family-run organizations at all levels and in all key decisions that are being made. It creates the ultimate model of family-driven care. And finally, family-run organizations are leaders too. They bring immense skills, expertise, and value to the table and bridge the gap. They have the intimate firsthand knowledge of parenting a child with behavioral health needs and navigating child serving systems, as well as understanding the mandates governing child serving systems and how to translate those for families. Whether it's recruiting, mentoring, and supporting family members to share their stories, to educate legislators, or facilitating a safe place for families to learn how to better manage the unique challenges their children present with, family-run organizations are leading the way. So on the right-hand side of your screen, Adam mentioned earlier, at the very bottom, listed as files, there are 3 documents now that are able to be downloaded. The first is a chart of roles that is organized by the Child and Family Service Delivery and Systems level that we organized this presentation through. The second is a resource list, and it's a list of documents that provide additional examples of ways that family-run organizations have or can influence systems and systems of care. And then the third document in there is the actual PowerPoint from our presentation. So we would really encourage you guys to take a look at those documents and also engage your outside stakeholders to have a conversation about, are there opportunities that your family-run organization has to enhance or expand your role, and really be strategic about partnering across systems to do that, as so many of our presenters described today. So I want to thank Lisa and Gail and Sandy for being willing to share their excellent work with us, and I think we have a few minutes that we will open it up for questions. Adam, can we, do we have the ability to open the line?
Yes, we do. Before we do that, just want to give everybody warning. We're going to unmute your line, so if you're having a side conversation, just be warned that your line will be unmuted. So we're going to unmute the lines now.
Thank you.
Leave a message. She might have left a message.
All right. Do we have any questions on the phone?
You talk all the time. So you just need to call her back.
We answer all the questions that people typed. I know that I saw Lisa and myself were typing quite a it was kind of hard to type.
Yes.
You know, I saw a lot of questions
Go
here
ahead, Gail.
that asked about family engagement and how to get families who are suffering fatigue engaged. And I always think that there are families that are fatigued. We have families that are working, trying to keep everything together, going to meetings to keep their kids healthy, and we get a lot of tired families, and we have to accept that. We also have to really remember that we have to have meetings that are in a safe place and at a good time, not where we're taking families out of, you know, their workplace. I think the fatigue answer is when we have events like going to the zoo, like Lisa said, or our Christmas party, or we have this big back-to-school bonanza. Those are really fun events that people, we try to make sure we get donations from the community, so there's door prizes and there's gift bags and there's food, always food. And those are the things that they're coming for an event and a little bit of respite because the kids are going to be playing a little bit and they can really look at tables where there's information and we kind of bring them back in that way. But really, I just think you should be honest with your families and don't expect, you know, we can't pick the same families to do the same policy things. You know, we always have to make sure we have a variety of families doing a variety of things, and it's really tough.
Mm-hmm. I would just add to that, this is Lisa, that the importance of self-care, both those of your family leaders who are your workforce, volunteers, and also invite the families you're serving. So we try to do quarterly self-care retreats, and we're really about starting at a place of helping people to feel that level of healing and support. And usually if you feel part of a network, that's an important piece, that we're not your traditional service provider, one family at a time. we encourage families to get to know each other, become their own network, connect with one another so that it will decrease that burnout and support that when you feel too alone. They also start to find a balance in what services are really needed in relationship to those natural support networks.
And one of the things, all our family partners are required to take a wellness recovery action planning course for self-care. And, I think that's really, really an important piece.
May I ask how you paid for the zoo experience or things like that? Do you pay admission fees for people?
We do a lot of grant raising, so we've been able to work with our local collaboratives who had some children trust funds, and we were able to write some small mini grants. And almost every event we've been able to underwrite and make all the admission free for our families, and usually has snacks or a meal connected to it too.
Thank you.
Yeah, we also get a lot of community donations. We have a lot of family partners that are real scramblers, and they know the people in the community, and they know who to ask. We get churches that always give us their property to have an event on. We have a jumbo gym. It's a for-profit company that has jumbo gym. They donate the use of their services once a year.
So this is Sandy, and I just want to talk the other side of this particular issue, which is really challenging. One of the things I found is that the larger we get organizationally and the more families we hire into the organization, the harder it is. We have to continuously go out and rebuild that, next tier of families who might be willing and ready to participate at the committee level or in doing some kind of advocacy. And we struggle with that. And so right now we're really thinking about what can we do to strategize around that particular challenge for us. Because that is an issue I think that we all face at some point is, we're already utilizing the talent of families that's been there for a while. And now what we're experiencing is we have families coming to us and wanting to participate who don't, we're having to reinvest and retrain, recoach folks, which we are happy to do. But we're just realizing that the families that are coming and wanting to give something are coming with less experience, less knowledge, less, we have to do more work to prepare them. So that's another challenge that I think it's important to keep in mind.
Thanks, Sandy. Any other questions before we finish up? All right, well, I think people have been sharing their emails, and feel free to contact Gail, Lisa, Sandy, or myself if you have any other questions. And thank you all for participating in the webinar.
Bye, everybody.
Bye-bye. Thank you.